Thank you very much, Eileen, and it's a pleasure to attend this conference. So I did prepare a few slides. First, echoing kind of the previous discussant, Eldon. It's really so great to see these. Each of the papers uses a longitudinal study of 2 decades on aging in a lower or middle income country, and it's really just wonderful to see. So I'm gonna speak about each paper in the same order and give kind of just a couple comments on each. So starting with the Mexico paper and the presentation by Danielle. So first, most of my work is in Mexico, so I really have to highlight how incredible the MHAS is. I think it's the only by far the longest running longitudinal nationally representative survey in Mexico. I don't know of any other longitudinal survey. There's the MXFLS that covers a shorter period, but so I sort of want to commend the MHAS for being pioneering, not just in aging, but in longitudinal household data sets in developing countries. So pioneering in many ways. So I'm going to focus, the paper, the first part of it looks at, kind of seeing what life expectancy, if you use the MHAS, what numbers you come up with compared with the official ones are published by CONAPO, which is the National Population Council, and they look pretty similar, which I think is kind of good news for everybody. So, but where I want to focus most of my comments are on this very provocative finding that life expectancy is lower in urban areas than rural, and particularly for men. And I was very pleased to see this, not because I have any bias against urban or rural areas, but it also reflects, I have seen this in my work with the vital statistics and in collaborations with Will and Emma Aguila. We've been working on this topic for a while, and what we do see using the vital statistics is lower levels of mortality in poorer rural areas, right? Which I always thought, I just had difficulty believing, and thought it likely reflected underreporting. So I'm just sort of wondering, how, first I'd like to see kind of how common is this? Is this finding in other lower and middle income countries? And then, my other comments kind of relate to exploring, this finding. So I wasn't very clear about how rural urban was defined. Was it based on, the residents at the beginning of, of the MHAS? And even if it were based at the beginning, so are you sort of comparing people always stay in urban areas, versus always stay in rural areas? I know that, older individuals don't move as much, as younger ones, but still I want to see, kind of how many move during this 2-decade period that the MHAS covers. And, I think, one advantage of the longitudinal data is, you have a lot of, and the MHOS, you have information on migration and birthplace and size of locality. So I think that you can try and tease out, like my last comment is a pretty broad question, right? Like, is there anything causal here that living in urban areas, leads to lower life expectancy, or is it, just kind of a selection issue? You could imagine rural areas in Mexico that have, lower access to hospitals and medical clinics. You might think that sicker individuals might migrate to more urban areas so that they have access to, to better healthcare services. So anyway, so I encourage, these are very provocative findings. I think we really need to understand them in in Mexico, and I encourage you to explore, the relationship between kind of current living relationship, previous living relationship, where they were born, was it rural, urban, and these differences that you're finding on life expectancy according to what I understand are kind of your current residents. Okay, I forgot how weird it is to present on Zoom. Okay, so I'm gonna move to the next presentation. Gender differences in living arrangement, mortality among Brazilian older adults, the presentation by Flavia. So another, really great panel data covering, the aging population in a similar period as to the MHAS for the city of Sao Paulo. And they're really concentrating on, what are sort of the, one, the association between living arrangements and mortality among older adults in Brazil, and how do those associations differ by gender. And, kind of the main result is this kind of clear ranking of living arrangements, which promote or associated with life expectancy for women, maybe less so for men. I actually want to put the graphs where, because you can really see this. This doesn't have controls, but I think that those don't make a huge difference in the results. And you see these really kind of striking differences in, for women, there's so the lowest for both men and women are individuals, older adults who live alone. But you see this kind of clear ranking for women that is less apparent for men. So for women, by far the best is living with partner, child, and or relatives, then partner without child, living with child or other relatives. And here you kind of see for men that alone is sort of the worst, but then basically the rest are kind of similar. So going back to my my comments, and I think actually that Flavia talked more in in the presentation that is actually in the slides about my sort of key question is, so what determines these living arrangements? And and Flavia, I think, gave us some answers during the presentation, that how these are associated with the death of a spouse. And that seems to be, very likely related to these gender differences that you see in terms of rankings. And again, I would encourage the authors to take on more, the question of, or explore more the question of causality or selection. I'm wondering about, if, and these are sort of questions that we can answer better with panel data. So, do individuals who are sick, are they more likely to move to live with, with their children? So anyway, those are my comments on that paper. And then finally moving to the last one, unintended effects of a large minimum wage increase on health, evidence from South Korea. So as we saw, the study is a large nationwide minimum wage increase using the Korean longitudinal study of aging. So the main finding is, we just saw this leads to an apparent same year reduction in significant reduction in cognitive functioning. Now, I want to just take a step back for a bit. That kind of the main challenge in these studies of minimum wage is, it's common. So this was a nationwide change in the minimum wage, right? We don't, have like regional differences. So this is a nationwide change that happened at, at the same time for everybody. So these are contexts where it's really difficult to find kind of what we would like to think of as a sort of randomly assigned control group. So this is a sort of particularly challenging context. So who's the control group in this analysis? Well, they're individuals who earn above the minimum wage before this change. And I guess, one question I have, is that a stable group? Because people sort of change their earnings, all the time. People change jobs, they come in and out of work. So, I'm not sure that it's sort of a, is it consistently individuals who are earning above the minimum wage? And I guess the mechanisms, I'd like to, I hope this, we'll get into this more in the discussion. I see that Will shared, a literature review on health and minimum wages. Why would we see this immediate drop in cognitive functioning? This doesn't happen over a few years. It happens literally in, the same year as the minimum wage. And actually, I'm not totally sure about that, because you're looking at the change between 2016 and 2018 in cognition, and the minimum wage change happened in 2018. So actually, it's possible that this change in cognition actually happened before the minimum wage occurred, right? Because you don't have sort of a continuous measure of cognitive function between 2016, 2018. So I think, when you have a maybe not very intuitive, result, like, we really kind of need to hear more about the mechanisms. So how could this possibly, have happened? And you indicate, a great hypothesis is that, well, maybe, minimum wages, they can, have effects on reducing or increasing unemployment. So, you seem to show that there's a reduction in work. Again, I wasn't too clear about whether that was a lower participation or just fewer hours for people who are still working. And again, I'm wondering about, the timing of the reduction in work. Could that possibly happen before the change in the minimum wage? So, and then I guess, my final comment, since you've got a small sample, there are a lot of assumptions in this analysis. The pre-trans one is pretty critical. And, again, one of the advantages of having this longitudinal survey is you can go back a lot in time. You're using, if I understood, kind of the last two rounds, but you can go a lot further back and do kind of a lot more complete analysis on the pre-trans. So finally, let me just conclude by saying I really enjoyed reading and commenting on the 3 papers. I congratulate the authors and the organizers, and I look forward to the discussion.